A new law gives Indiana's 5 big nonprofit hospitals an ultimatum: lower prices or pay up.
And we think it sets a great path going forward for the state of Indiana.
Matt Bell with Hoosiers for Affordable Health Care says this law has been a long time coming.
And ultimately, it creates a choice for hospitals. They'll have a choice to lower their prices to a state average that will be determined by the Indiana Office of Management and Budget. And if they choose not to, large hospitals would therefore be responsible to pay property taxes to local communities.
He says Hoosiers should expect accountability and transparency from their healthcare providers.
I believe it holds to account insurers and hospitals who have really profited on the backs of Hoosiers.
Bell explains we won't see price changes overnight. These nonprofit hospitals have until June 2029 to cut their prices to the statewide average. And it's not a small cut. A study from Hoosiers for Affordable Healthcare says IU Health and Parkview Health would have to reduce their prices by more than 40%.
The legislature, I think, took great steps to ensure that there wouldn't be dramatic shocks to the system, loss of access to care.
For the average person watching this, maybe just from this area in Northeast Indiana, what do you think they need to know about this becoming law on July 1st?
So I think Hoosiers should be encouraged that the approach really focuses on both insurers and hospitals, payers and providers. They should expect to understand far more about how folks are being compensated for the insurance policies that they buy.
Bell says at the end of the day, these hospitals can still decide to keep charging patients the same and in turn start paying property taxes and lose the nonprofit title.
I'll be disappointed if that's the choice that the large nonprofit hospital systems make. But should that be their choice, I think it's a revelation of their true colors, that really we've decided to put profits ahead of people.
We reached out to IU Health and Parkview Health for a response. A Parkview spokesperson sent a statement saying in part, quote, "Unfortunately, while the provisions of HB 1004 will create significant administrative burdens for all Indiana hospitals, it will ultimately unfairly target 5 nonprofit health systems. Given the ambiguity in the law, which creates unprecedented private market interventions, we are unable to say how it may impact costs or access to high-quality care in Indiana's rural communities," end quote. IU Health has not gotten back to us. Reporting in studio, Meg Rossler, 21 Alive News.